and everyone is trying to, you know, keep up with the Jones.
Yes, yes.
So, but it's not a possibility, I think, especially not with the masses that we've got.
That's right.
Where screening itself is a very, very difficult task. We have a mammogram center where we subsidize the mammograms for the people. We get NGOs to support us and, you know, send in the women. We try and raise funds to try and do it free of cost, and otherwise also we are doing it at a highly, highly subsidized rate. You know, we don't get very many takers.
That's right.
It's really very difficult. We have a detection center at Barber Road, the Indian Cancer Society, where just for 200 we find it very difficult to be able to get people to come in there. We go out in the field, we conduct a lot of awareness talks, you know, ranging right from the Jhuggi Jhompdi areas to the corporates, trying to get in as many people as we can. We have a mobile van that goes around also, you know, wherever we've conducted the awareness camps, to be able to go and do the same thing, but as a mobile unit and take it to the people who can't come to you. We find it very difficult. It is a difficult task to be able to get through.
Absolutely. So on the one hand, it may be, yes, you want to
not let their wives go out. We had a camp in Barabanki where we have more of the weaver population there, and most of the women were in very poor health, but they wouldn't come out because their husbands would not allow them to come. And that's where we have to explain to them that you have to be responsible for your own health, you have to be responsible for your own selves, and come out and get the checkups done when we are literally going to their doorsteps.
That's right.
And we're not charging them anything. We are doing the pap smears also, we are doing the liquid cytology, we are doing monitoring of the blood pressure, sugar, random tests, everything what we can, what is required for their health. But yet they are not wanting to come out. They have to be coaxed into coming out.
Basically, this factor is with the women.
Yeah.
Like a happening.
I think even males are very reluctant.
Are they?
Is it?
I don't see people having regular screening and all health checks, even PSAs, and I don't think that is part of our culture. I don't think it's about men, women. It's basically it's a cultural
Now also,
thing.
Dr. Harith, if there is on the one side, they are saying that, you know, people really don't go for checks, but there's also another aspect to it where people are talking of over-diagnosis of breast cancer. So in that scenario, what is the reality really?
Okay, so one thing, let's put straight that genetic transmission is only 5% of total breast cancer.
Okay.
So what is at the center of discussion today is actually not 95%, it's 5%.
Right.
And it is not a screening tool. BRCA gene is not a screening tool for mass population. It's a screening tool for a specific group of people. Okay, and this is also available free of cost at Cancer Institute, Adyar, Chennai, and also in TMH. AFTREC does a screening. They give a delayed reports because they club the samples and then do it. So if you qualify for that test, that can be organized from these centers. So, and not just breast cancer has BRCA gene, there is a colon cancer, there is also genetic risk is associated and known. There is a thyroid cancer, there's a familial genetic transmission which is known. So it is not over testing.
That's right.
One can do a mammogram or one can do an MRI and all these things. So this kind of a threshold, at what threshold you do a particular test, is related to both the symptoms of the person, the examination findings, and also the, I would say, the way the doctor looks at it. Same situation, two doctors may advise two different things. So I think uncommon tests should not be advised very rampantly and not loosely asked for, especially these expensive tests like MR, mammogram, these things should not be very loosely asked for. But we must appreciate that in young women, in dense breasts, in certain situations, this is the only valuable tool. So if somebody is having symptoms and I am sitting in that chair to take a decision, for me to say that you don't have cancer is more difficult than to say that you have cancer.
That's right.
If I give you a signal you don't have cancer, then I am bearing a big burden. So I am very much tempted to say, okay, do one more test and be sure. So when will I say this, that okay, do one more time, be sure, is when I am thinking 10-15% there may be something. So I will say, okay, do one more test. If I am less than 5% suspicion, I will say, okay, come back after 6 months, we will reassess the whole thing. So these are ways we think. There is a natural algorithm in our mind that how to advise a test. It happens day in, day out, so it becomes part of your functioning. But I must say that these are all important things and very much have evolved over a lot of work by scientists and people who have developed these things. So let us use it for the right purpose.
Absolutely, using it for the right purpose, I think. punchline here, that whatever tests that are available, that they must be used for the right purpose. Well, folks, it's time for us to slip into yet another break. When we come back, we'll tell you as to what are those symptoms that you must look out for and when is it time for you to get tested. So don't go away, as we are coming back in just a moment. You're watching Gender Discourse, and today we are talking about breast cancer, treatment options and the market forces. All you'll have to do is call us on these numbers, as the lines are open today, and the numbers are 1800115314 and 23035420. Remember, we are talking about breast cancer today. We are talking about the treatment options, and we are also talking about the market forces. This is the story that is being done these days in every newspaper, every channel. So we are talking about the same thing. So do call us and tell us as to what is your issue here. Okay, so now Namrata, talking of all this, I think this is also a platform where we need to give, some kind of information to the women out there as to when is it, till at what age should they really go for that first mammogram test?
As per the NHS, that is the UK-based National Health Scheme, we at ROCO go by the directives given in NHS, and that is every woman who is 40 is when you have to have your first mammogram, and then you can go for regular screening mammograms thereafter. If you've had a first degree relative in your family, that could be your mother, your daughter or your sister maybe, in that case, the age at which your relative has been diagnosed with that disease, 10 years prior to that age. So for example, if your mother has been diagnosed at the age of 50, you need to have your first test done at the age of 40.
Right.
So this is the standard that we go by in absence of any kind of a symptom, and we are talking about the screening mammography. And we do the screening mammogram when you don't have any symptoms in your body. Otherwise, the other tools become the diagnostic, when you go to the doctor with some kind of a symptoms. Now the symptoms of the breast cancer that you need to look for, at working in this area, working at the community level, we've come across that the women, they do not readily want to talk about their private parts. In most cases, these breast lumps are painless, so they can go on with their regular day-to-day chores, and they don't talk about it.
Right.
Even in you were just talking about a while back, the husbands, the males, they are so reluctant to talk about their women's health that they would say it's nothing, and women would. And fourth that you would look for is in a kind of breast cancer, that is the inflammatory cancer, which is the more aggressive ones, especially in the young women. The skin, you might not obviously find any lump, but the skin overlying the breast gland, it gives an appearance of an orange, like the peel of an orange. It's thickened, the color changes, and it's pitted. So that is another symptom that you need to look for while examining yourself on your own with you would do the self-breast examination. It's very easy. You could just use your two hands as a tool for that. All you need to do is just examine yourself, touch your breast and the axilla, look for these symptoms, the lump, the discharge, the change in the size and the shape, or the change in the skin, with just the soft part, the tips of your three fingers. That's as simple.
Of these symptoms, sometimes half the, of course, as they say, they all think that this is going to be cancerous. So I think the counseling part is also very important here. So when a woman goes for that test, do you think counseling is important even at that point in time?
Yes, absolutely. It is definitely important that we have to, the fear we have to remove from her.
Right.
And we have to feel that the proper treatment will be given to her, because in our case we are only doing awareness and early detection, but we do not want to leave the patients in the lurch. So we do advise them and we guide them further on from this, where they have to go and what precautions they have to take. And we definitely
factors where today they are saying that breast cancer is basically becoming an urban phenomenon, and it's on the rise because all our sedentary diets that we've got, the women have, their lifestyle, late marriages, late children, and the diet, exercise is only now catching up.
That's right.
Because of
we have to understand lifestyle. All that which is perceived as good habits has good value. Quit tobacco, consume alcohol in moderate
quantities.
Not in large volumes, and fruits, vegetables, exercise.
Point is in focus. Are you expecting that a many women will now actually come up for those tests, or at least ask for awareness?
It is already
yes,
happening.
it's happening. It's happening. It's happening.
Last 2 weeks we are seeing a difference. So it's happening.
And what is the kind of in the hospitals? What do you really see? Any changes?
Yeah,
you see
we
more
see
women coming in?
queries. All our old patients, they come with their daughters, with their family members, what should we do for them? All this is happening actually. And in fact, today I at least got 3 phone calls this breast conservative surgery. You have to have radiation also as part of the treatment. And it is a lot of women in my practice also, when we discuss these options, breast conservation, mastectomy or mastectomy with recon, I would say almost 70% choose mastectomy even when they are eligible for it. So if I have to say who is not eligible for conservation, that group is always advised mastectomy. So that means multicentric disease, a big tumor in the breast. However, even if there's a big tumor in the breast, big means more than 4-5 centimeters. And it's also tumor breast ratio. In a large breast, a 4 centimeters may not be that big. You can still have a decent cosmetic outcome. But even the tumor is big, sometimes we give chemo first. If the person is inclined for conservation, we give chemo, regress the tumor, and then do surgery. So you can still conserve the breast in the biggest tumor. But multicentric disease or BRCA tested positive and still you have a small breast cancer, it is better to have a mastectomy because still risk remains. Then people who have had radiation earlier to this part, people who do not have access to good radiation backup, or even in where there was a bulky disease in the breast, the response is good, but clinically it's debatable. It's better to do a mastectomy. And one must also know that when we do a mastectomy versus conservation, in suitable cases also, the overall survival is equal, but the local recurrence rate is about 1 to 2% higher in people who have conservation. So all this is important. Radiation is mandatory and these things should be understood.
All right. Well, I think now that we are running short of time, so on this note, I'd like to say thank you to all 4 of you for taking time out and for talking about breast cancer and its awareness. Well, friends, essentially the lesson from Ms. Jolie's story is that cancer is preventable. Spreading awareness about this is still a mammoth task in India. A large number of cancers are being detected only when they are too advanced, at a stage where medicine can do little or nothing for the patient. While prevention